Hi everyone, my name is Carrie. I'm one of the pharmacists here at Markham Stouffville Hospital. Today we're going to be talking about medications that you will be started on after you've had your hip or knee surgery and what to expect after that. Today we are going to talk about your current home medications as well as new medications you may be started on after your hip or knee surgery. These include medications for pain, laxatives to prevent constipation, iron supplements, and blood thinners. If you are taking medications for other medical conditions other than your surgery, you will most likely be continued while you are in hospital. If there are any changes to your home medications, we will let you know prior to discharge. You will be started on some new medications after surgery. Please let your nurse or pharmacist know if you have any allergies to medications to best prevent allergic reactions. If you are started on any new medications or if there are any changes to your medications between now and the day of surgery, please let your pre-operative nurse know when you come in for surgery. Please pack all your medications in their original bottles and bring them with you, especially things like puffers, eye drops, insulins, or supplements. You may be asked to use your own medication if the hospital does not have the specific medication you are taking. As with any big surgery, you can expect some pain. At Markham Stouffville Hospital, our goal is to manage the pain using medications you take by mouth. Some pain medications will be given intravenously if needed. A combination of non-opioid medications as well as opioid medications may be prescribed to help manage your pain. Non-opioid medications may include acetaminophen or Tylenol, an anti-inflammatory such as celecoxib, a medication commonly prescribed for nerve pain such as gabapentin, and opioid pain medications such as hydromorphone. Most of the time, pain can be managed using oral medications. If your pain is not well controlled on oral medications, you may be started on an opioid medication intravenously. This will be given to you in the form of a patient-controlled analgesic pump, or PCA. This pump is controlled by you. It is pre-programmed to deliver a specific dose of medication each time you press the button. However, it has safety measures programmed as well to limit the number of times you can push the button in a given hour in order to prevent overdosing. If your pain is not well controlled with the PCA pump settings, please let your nurse know. Some common side effects of opioid pain medications include nausea, vomiting, constipation, itchiness, a rash, or drowsiness. It is important to let your nurse know if you have any of these reactions. You will get a prescription for pain medication to fill at your pharmacy when you go home. Most prescriptions will include a combination of opioid and non-opioid pain medications. It is important to take these non-opioid medications such as Tylenol regularly, even if you do not have pain. These can help control your baseline pain and decrease the amount of stronger pain medications that you may need, such as opioids. Opioid pain medication that you may go home with come in two different formulations: immediate release and controlled release. Hydromorphone immediate release, or IR for short, should be taken only on an as-needed basis. Hydromorphone immediate release tablets can take up to 30 minutes to work and can last about 4 to 6 hours. Hydromorphone controlled release, or CR for short, is a long-acting hydromorphone that should be taken on a regular basis. This medication takes about an hour to work and can last 8 to 12 hours. You should always start with the lowest dose and adjust up if your pain is not well controlled. Take opioid pain medications for the shortest period of time. Your pain should improve about a week after surgery. Patients rarely need to take their opioid pain medications beyond that. It is important to store your opioid medication in a safe place, away from children, teens, and pets. If you have any unused opioid medications, please bring them to your pharmacy to safely dispose of. Never throw them in the garbage or flush them down the toilet. Lack of mobility, pain medications, iron supplements, and a change of diet can all contribute to constipation. You will be started on a laxative called Laxaday or Restoralax after surgery. It is a tasteless, odorless powder that is dissolved in any liquid such as water, juice, or tea. You may want to continue to take laxatives while you are taking opioid medications to reduce the chances of constipation. During surgery, some blood loss is expected. Hemoglobin is a lab test that is done to measure the amount of red blood cells in the body. If your hemoglobin drops below a certain point, you will be started on an iron supplement after surgery. Your pharmacist will let you know if you need to continue the iron supplements when you go home. Patients who undergo hip or knee surgeries are at higher risk of developing blood clots. Everyone is prescribed a blood thinner to prevent blood clots. These are usually started on the day of surgery or after. There are different kinds of blood thinners. These include rivaroxaban, which is a tablet, enoxaparin, which is an injection, or a combination of rivaroxaban and baby aspirin. The choice of blood thinner will depend on your surgery, the type of surgery, and your other health conditions. You will most likely continue your blood thinner when you are discharged home. Before you leave the hospital, you will be provided with a medication list, which contains the duration and dates you should take the blood thinners until. If you are going home on an injection, a nurse will teach you how to self-inject the medication and ensure you are comfortable doing so. The usual duration of taking the blood thinners is between 14 to 35 days. If you were having a knee replacement, you should take the blood thinners for 2 weeks after your surgery. If you were having a hip replacement, you should take the blood thinners for 3 weeks or longer. It is important to take your blood thinner regularly as prescribed. However, if you forget to take a dose, but it is still close to the time you usually take it, then you can take that day's dose. If you forgot to take your dose and it's the next day, please do not double up on your dose. You can continue to take your blood thinner once a day at your usual time. Before you are discharged, check with your pharmacist or nurse when you should take your first dose at home. If you were already on a blood thinner at home, the pharmacist will let you know when to restart your usual blood thinner after surgery. Although you will be taking blood thinners, there is still a slight chance that you could develop a blood clot. A blood clot in the leg is called a deep vein thrombosis, or DVT. Signs of a blood clot in your leg include local swelling, pain, warmth, or change in color in one or both of your legs. It may not necessarily occur in the leg you had surgery on. If blood clots in your legs are not treated appropriately, they can travel to your lungs and cause a pulmonary embolism, or PE. This is a medical emergency. Symptoms include severe chest pain, shortness of breath, or difficulty breathing. If you have any of these signs and symptoms, you should go to your nearest emergency or call 911. New clots can also form in arteries from the heart and travel to your brain and cause a stroke. Warning signs of a stroke include sudden numbness or weakness, especially on one side of the body, sudden confusion, trouble speaking, and trouble seeing from one or both eyes. If any of these warning signs appear, please call 911. If you need to see a dentist while you are taking a blood thinner, please let them know. There has been confusion surrounding the risk of patients with prosthetic joints developing joint infections due to infections in the blood after dental procedures. The Canadian Dental Association does not recommend routine antibiotics prior to dental procedures after joint replacements, unless you have a specific heart valve condition. However, each surgeon has their preference. Please check with your dentist or surgeon. To prevent prosthetic joint infections, you should maintain good oral health before and following surgery.